I'm Dr. Nicole. I am a board certified psychiatrist, and one of the things I love the most is educating people on a variety of mental health topics. There is so much misinformation going on out there in the world and on the internet, and I just want to be a part of clearing that up and giving you accurate information. Today, we're going to focus on depression. What is depression? Depression is a very common medical disorder. And notice I said it's a medical disorder because I want us to consider our mental health as part of our overall medical health. A lot of times you will hear people say things like behavioral health or mental health, but I think that does a grave disjustice to what's going on in our bodies. Your brain is a part of your body. It's one of those systems that we're concerned about. So we're going to consider our mental health as our brain health. So what is depression? According to the Diagnostic and Statistical Manual, 5th edition, so the DSM-5, when we think about a major depressive episode, we think about a period of time that lasts at least 2 weeks and consists of either low mood or loss of interest. That becomes important because I often see people who just don't have the words to say, I'm depressed. I see people all the time who say, I'm not really sure if I'm depressed or not, or I wouldn't really say I was depressed. And I think that's because it's really hard for a lot of people to say I'm depressed or to see depression in themselves because we have this preconceived idea of what depression looks like. And if ours doesn't quite fit that, then we don't always think that we fit that mold. So loss of interest or low mood. So even if you can't really say, I feel depressed, I feel down, if you can say that you are not able to find pleasure in things that normally bring you joy, you're not able to find excitement about things that normally bring you excitement, that may be enough to meet that initial criteria. Along with those two things, we are looking for sleep changes, whether that's I'm sleeping too much or I have a desire to sleep too much, or I'm having difficulty falling and or staying asleep. We've already talked about the decrease in interest for things that you used to enjoy. Energy can definitely be decreased with a depression episode. For some people, they experience impaired concentration, so they may tell me things like, I'm more forgetful, I just can't focus, I lose my train of thought frequently, along with their depression episodes. Increase or decrease in appetite can be seen with a major depressive episode. Some people might experience feelings of worthlessness where they are blaming themselves for things that couldn't be their fault. They may feel like they're a failure to people that are in their lives that they care about. They just may feel not good enough. Some people experience what we call psychomotor changes, which means they may feel like they're moving slower than normal. They may also feel more restless and fidgety, like they're moving more than normal. And some people with their major depressive episodes get to a point where they might experience suicidal thoughts. And they may not always be thinking, I'm going to kill myself, but they may have what I call suicide adjacent thoughts. So thoughts like, I'd be better off dead. People around me would be better off if I wasn't here. I wish I could just disappear. And some people actually have thoughts of taking their lives. When we think about major depressive episodes, we tend to categorize them as either mild, moderate, or severe. And this is important because I think a lot of us, when we think of depression, we tend to think of someone who can't get out of bed, can't get things done, who looks sad on the outside. But we all know, we've heard this term, high functioning depression. And a lot of people I see come to me and say, maybe I have high functioning depression. Basically, that just means that your depression is significant. You are having these symptoms. You are not functioning at the level that you're used to functioning. But maybe it's not that apparent to everybody around you. Maybe you're still going to work and you're still getting your job done and you're still taking care of the kids and you're still helping your parents and you're still doing all the things. You're in all the activities. You're at the Jack and Jill meetings. You're at the sorority meetings. You're at all of these things and you're still there. But you're still depressed. You're not enjoying those things. Your sleep is off. Your focus is off. Your appetite's off. All those things we talked about. So when people mention high functioning depression, it may just mean that their symptoms of depression are not as evident on the outside as maybe they would be for somebody else. When we think about major depressive episodes, we also have some exclusionary things. So if you are using a substance and that is why you are feeling depressed, we wouldn't necessarily consider that a major depressive episode. If you're someone who's drinking heavy alcohol and you develop a depression episode secondary to that, we wouldn't consider that a major depressive episode. Maybe you're taking a medication that has negatively affected your mood. We wouldn't consider that a major depressive episode. For some people, their mood symptoms may be secondary to another medical condition, and we wouldn't necessarily include that as a major depressive episode. We would consider that to be an episode secondary to that condition. And then there's always the topic of grief. A lot of people say, I'm not sure if I'm depressed or if I'm just sad. Am I grieving? And it can be pretty tricky to tell the difference. You can also have both. You can be in a depression episode and then lose a loved one or grieve the loss of something, someone, some phase of life, and find that you have grief superimposed on top of your depression. But if you question, am I depressed or is this grieving? One tip might be to ask yourself, is this an all the time thing? Because depression tends to be pretty pervasive. It tends to be most of the time that a person feels low, they feel down. With grief, that sadness is pretty transient. You can still have good times. You can still find yourself laughing and enjoying things. But maybe you just have these random moments where you think about that loved one and sadness hits. Or you do something or you are reminded of that person and all of a sudden you feel that grief. Sometimes with depression, we've talked about the suicidal thoughts or the thoughts of being better off dead. There are sometimes thoughts of death that come with grief, but they tend to be more related to thoughts of your own mortality and death along those lines. Or it could be that you find yourself having thoughts of longing to be with that loved one that you miss. So those thoughts of death are a little bit different in grief as compared to a major depressive episode. Sometimes we find that we are just saying the same things, but we speak different languages. People will often say, well, I don't have major depressive disorder. I have clinical depression. And I am here to tell you, very likely you're talking about the same thing. When people use the words clinical depression, they are usually referring to what we call a major depressive disorder. So we are probably saying the exact same thing. Some people have what's called persistent depressive disorder. And if you have been familiar with mental health terms for a long time, you may remember this being called dysthymia in previous editions of the DSM. Basically, persistent depressive disorder or dysthymia, this is someone who has a depression episode for an extended period of time, like at least 2 years, but they may not have all of the criteria or even the majority of the criteria that we mentioned earlier. It may be someone who says, I'm always kind of down. I'm always kind of sad. But I don't have but maybe 1 or 2 of those things you mentioned earlier. You might be looking at a persistent depressive disorder. We also know about seasonal depression. People will often come in about November and say, every time, this time of year, I get to feeling down. I think I have seasonal depression. We would still consider that you have a major depressive disorder, but we would say it's with seasonal onset. And for you, your season may be the winter time. That's when I think we most commonly see it. And when we think about it, we think of those people who are down in the winter. But there are some people Their seasonal time for their depression is spring and summer. It's not winter. So it doesn't matter the season. If you notice that you have depression episodes kind of happen around the same time of year every year, you may have a seasonal component to your major depressive disorder, even if it doesn't fit the typical thought of it being winter related. People will often ask me what causes depression. A lot of times this comes up when someone is sitting in front of me and they say to me, I don't really have a reason to be depressed. My life is good. I have a family who loves me. I have a great support system. I'm financially stable. I love my career. However, I just can't shake this feeling that I'm not happy no matter what I do. It always transitions to a conversation about what are the possible causes of depression. Initially, I always talk about the biological causes of depression. For some people, their brain function, for whatever reason, makes them more at risk for depression. For some people, it has to do with the chemicals that run around in our brains. You hear word of neurotransmitters, things like serotonin, dopamine, norepinephrine. Those are the chemicals in our brain that can affect our mood. And when they're not at the adequate levels or in the right amounts, at the right places, at the right times, you can experience depression. That's why a lot of our medications act at one of those chemicals in the brain. For some people, it is genetic factors that contribute to your depression. You may have one member with depression. You may have multiple family members with depression. We know that when you have a first-degree relative, like a parent or a sibling who has depression, it makes you 3 times as likely to develop depression yourself. But, hear me when I say, you can have no family members with depression and still develop a depression episode. And I also have to throw in there, maybe you do have a relative with depression that you just don't know about, because let's face it, we're not always talking about these things as we should in our families and sharing these things with our loved ones. So you could have someone in your family who has depression who maybe never even realized what they had was depression, and even if they did, they may just have chosen not to share that with others. Depression can be caused by substances. Sometimes those substances are things like alcohol or illicit substances. Sometimes the substance can be a medication that you may be taking for a totally different reason, but that can cause your depression as well. And for some people, depression can be caused by medical conditions. You may have a chronic illness, a chronic medical condition that can absolutely negatively affect your mood, and that can be a cause as well. Sometimes your depression symptoms can be brought on by what we would call psychosocial stressors. You might just refer to them as everyday environmental stress. So the things that are going on in your day-to-day life that can lead to your depression can include things like financial stress, job stress, family tension, trauma. Any of those types of things can interfere with your mood control. Hopefully that review has given you a better idea of what depression actually is, and maybe also what depression isn't. As a reminder, this is just for educational purposes. I absolutely encourage you to go talk to your healthcare team, your primary care doctor, your psychiatrist, your therapist, if you think that something you heard in this video resonates with you and you want to explore it further.